Hello and welcome to Downriver Rescue Connection. I'm your host, Patty Radikovich, and it is my pleasure to bring you information on animal-related topics in the animal rescue community. On today's episode, we're going to be talking about integrative veterinary medicine. And I found a very special person to discuss this topic, and that is my friend, Dr. Kristine Butto. So welcome to the show.
Thanks, Patty.
So I wanted to invite Dr. Butto to this episode to talk specifically about integrative veterinary medicine because that is what she is an integrative veterinarian. She has been doing regular Western medicine for quite some time, 20 years. And just in the last, I'd say, 5+ years or so, she went and became trained in traditional Chinese veterinary medicine, as well as becoming a certified veterinary acupuncturist. And then there's a bunch of other therapies that you do as well. So I thought you were the perfect person to talk about this topic. And not to mention that we're friends and she's been treating my animal for a very, very long time. Yep. So tell the viewers, first of all, what is integrative veterinary medicine?
Well, integrative veterinary medicine is where you take Western medicine and Eastern medicine and combine the two. And they each have their strengths and they each have their weaknesses, and they are such a good complement to each other. So there isn't probably a patient in my hospital that we don't do that approach.
Great. And so when we talk about on the integrative side, everybody kind of knows, what a regular vet does from the Western side. Mm-hmm. But what are some of the therapies, or as it's called, modalities, that are offered from the holistic side of things or the Chinese side of things? Mm-hmm.
Well, there's herbal.
Okay.
A lot of it's herbal. Probably 80% of it is the herbal and 20% is acupuncture.
Okay.
And it depends on the case. Each case is a little differently. But the Western medicine tends to treat symptoms. Mm-hmm. So, if you have a fever, you're going to give some for your fever. And where Eastern medicine tends to treat the cause of the disease. Western medicine is going to make you feel better right away, probably within an hour, whereas Eastern medicine can take several hours, if not days, for it to work. So I usually use Western medicine at first and waiting for the Eastern medicine to start working.
Okay. And so some of the Eastern medicine or the holistic philosophies, the modalities would be, like you said, like the herbals, the Chinese herbals, there's acupuncture. There's also things like stem cell,
laser,
cold laser therapy, Reiki. There's a lot of different what they call modalities. I mean, the list just goes on and on. We couldn't even include all of it probably in this show.
Right. Massage.
Yeah, massage therapy is another one. And so these are all therapies, or like I said, modalities that can complement or they can take the place of medicine in some cases. And it's up to you as an integrative doctor to decide which ones out of my toolkit am I going to use and what's best for the patient.
Right.
So the one point I want to get across is that a lot of people get confused when they hear the term holistic or homeopathic, things like that.
Natural.
They think it's at the exclusion of Western medicine, and it's not.
Right.
And I know you had told me a story before about what your teacher had said in class. It's the difference between who you would want standing next to you.
Oh, yeah. Dr. Shea would always say if you had trauma or you needed to be diagnosed, you want a Western doctor standing next to you because we have all the big, diagnostic tools, and we're very good at trauma medicine. But if you have a long-term chronic disease, you want an Eastern doctor standing next to you. So they're a beautiful complement to each other.
Okay. And so can you give an example to kind of showcase the benefits of it? Can you give an example from one of your patients, maybe somebody you had started working with before you really became an integrative doctor, and how your therapy for them changed over time?
My favorite story is when I was in school. I had a little dachshund come in who, of course, was paralyzed, and she was only 2 or 3 years old. And she had no deep pain, was completely paralyzed, blew a disc in her back. And unfortunately, her family had lost another dog, another dachshund, and had gone through the surgery and done everything, and nothing helped, and they ended up putting the dog down, and had spent, I think they said, $6,000 to do this. So they, this nightmare reoccurred with their new dog, and they were very, very against going that route again. So I told them I was in acupuncture school and would they let me keep their dog for a couple of days and acupuncture her. And they allowed me to. And I did her acupuncture. The next morning, my technician called me to tell me that she was standing. So I treated her again. And on the third day, I had them come get her. And I sat her down at the door of the exam room and opened the door. And she ran into the room and tried to jump on her mom. And I'm like, no, don't jump. But it was the beginning for me. And that little girl would have lost her life with not having acupuncture done. And I love that story because her whole family started crying.
Right.
And it was I wouldn't have had that to offer them. I would have just euthanized their dog. And over and over and over again, we have patients that come to us that just need something different, and we're here to provide that. And it's a great option.
Right. All right. And so one of the things that I've noticed that, and you'd already said this about the chronic conditions, so there's a lot of, just like a lot of people nowadays are getting these autoimmune conditions, a lot of animals are getting autoimmune conditions, and people aren't seeing that. And some things that we don't think of, like inflammatory bowel disease, IBD, that's an autoimmune issue. And that's something that a lot of times, like, I know regular treatments are usually steroids to help reduce the inflammation. But like, what are some things that you can do for something like that with the more integrative side and with the herbals?
Well, first of all, one thing we didn't talk about modalities is food.
Oh, yep, that's another one, nutrition.
Yeah, especially when it comes to dogs and cats, because what I always invite people to do is to think about their dentation. A cat's dentation is completely serrated teeth. They don't have any grinding molars. And go read the ingredients on your cat's bag of food. It's going to say corn, wheat, and either chicken meal. And really, truly, Mother Nature did not invent kibble. She invented a predator that eats prey. So a lot of our dental disease, our inflammatory bowel disease, our autoimmune diseases, these animals are literally trying to process and digest things that they were never designed to eat. And then again, we don't feed them moisture in their diet, so we get a lot of kidney disease. So not only do you have environmental things, depending on where you live, we actually live in an industrial area. We have a lot of sulfur in the air, we have sulfur on our ground, we have sulfur in our water. So a lot of that contributes to the chemicals companies that are around. I mean, there's just so much, you're inundated with it. And if on top of it, you're eating something that you're allergic to, your body just can't take it anymore. So it's important the nutrition is correct for the species. So
okay, so that might be the number one thing that you would look at is
especially when it comes to inflammatory bowel. Yeah.
Okay.
Number one. And then there's herbals that absolutely strengthen the GI tract, that help balance it, where you're not trying to absorb too much water or not enough. There's a lot of things that the body tries to do to compensate for a poor diet or for, things out in the environment. So the herbals definitely complement that.
Okay. Now, since you had brought up food, are there just some general recommendations that you can give people about, and this is, for general healthy animals, because obviously if there's a specific condition, their diet might be different, but are there just some general recommendations you can give about what we could feed our animals? Like, you hear a lot about the grain-free diet these days, and you had mentioned that there's a lot of kidney disease because they lack moisture. So what are some things that owners can do to kind of prevent some of these chronic conditions?
Well, first of all, no grain.
Okay.
That means no corn, no wheat, no soy. It doesn't mean that there's not some grain in it, meaning rice or, there's some carbohydrates in it, but we really need to get away from the corn and wheat and soy. And definitely canned food. Again, no grain. And I do give my animals people food, not Doritos and pizza. I give them people food, and that means that my dogs get blueberries, bananas. They get, if we're having chicken, I use chicken without spices on it. I mean, they actually get real food. They have moisture in their diet. The cats, I give tuna fish, any kind of lunch meat that we have, that kind of thing. So, and just, I always think about what would Mother Nature feed this animal? And so definitely meats, fruits and vegetables for the dogs, and the cats just kind of stick with meat. There's also raw diets, which are beautiful. If you have the time and the resources to do that, raw is the way to go. That's what we were designed to eat, and so were our pets. So raw is a whole nother ball game.
Okay.
That's a long story, but if people are willing to do it. Some people do homemade diets because I have animals that are allergic to the kibbling process, the drying agents that they use to dry the food. I have animals that are allergic to nickel in the cans. So there's, all kinds of reasons and things to think about why your animal's having digestive problems. And first and foremost is, what are they eating?
Right.
So.
Okay, maybe we'll do a whole show just
on that.
Animal nutrition. But that's a really good point to get across to people is, if people are wondering what is it that you can do to help your animals to be healthy, it's a good point is to look at the diet. It's the same for humans, is look at what you're eating, look at what you're putting in the body, and is the body really designed to digest this and to process this? Right. And then if it's not, you really need to take a second look and say, okay, how can I change this diet so it's more appropriate for this animal?
Right.
So now we had mentioned herbals a little bit, and one of the things that I know that you're passionate about expressing information about herbals, and I do as well with people, is a lot of people think that herbals are completely benign in the sense that, oh, it's an herb, it comes from the plant, you can take as much of it as you want, and it's never going to hurt you, and that's really not the case. So can you explain a little bit what herbals are and just in general, like how they act in the body and how they're different from drugs?
Well, the first thing I always want people to know is Western medicine uses herbals. The vast majority of drugs on the market come from a plant. Aspirin is from a tree bark. Digoxin, which is for heart, is actually from a plant. So a lot of Western medicine is actually herbal. And I tell people that arsenic's natural. It also will kill you. Oleander will kill you. I mean, there's so many things that people consider natural, and it doesn't mean they're safe. It doesn't mean they don't have drug interactions. They're very powerful drugs, and they need to be respected, and you need to be knowledgeable and not just throw a ton of herbs at an animal. And that's actually, a little aside, the Chinese herbals, if you look at them, there's a minimum of 10 ingredients in it. This is thousands of years of information about if there's a side effect for one herb, they put another herb in it to negate that. So I love the formulas because you don't have a lot of side effects with them. But I'm always very, very careful that people don't think that just because it says natural or homeopathic or herbal or whatever, holistic, does not mean that it's safe. Okay. You need to be careful.
So the point is, herbs are drugs as well. And so even things that people sometimes think, oh, this is sold on the supermarket shelf. I've heard that it's good for humans, so it must be good for my dog or my cat. And that's not the case a lot of the times.
Yeah, Tylenol will kill your cat. So, and no, don't do that.
All right. So now, with the integrative medicine kind of coming more into light these days, and you see more people and more vets proclaiming to practice it. The question comes up is, the public is not really familiar with traditional Chinese medicine. They're not familiar with laser therapy and stem cells and all these new modalities that are coming out there. How can somebody know if a vet is actually qualified to do this? Because they're looking at people that they've got the DVM after their name. If they're offering a service, they must be qualified. And unfortunately, that's really not the case when you come to some of these integrative services. So how can the public protect themselves and their pet and know when somebody is properly trained?
Well, the first thing is to ask. Ask the veterinarian where they got their training. They should be, if they're certified, they should be able to tell you where they got their training. And if you walk in my office, you will see our diplomas on the wall, for all the different things that we do. A lot of times the institutes that they name will have their name. They usually will list the doctors in the area, or they'll say you're looking for a holistic vet in the area. They'll have their name. The Chi Institute does that. There's holistic veterinary memberships. You can check and see if the vet's listed on that. But it mainly ask, and if they can't provide a good answer to you, then you might want to look elsewhere. But
Okay.
most vets that are advertising that are hopefully certified. At least the ones I know are. so I don't think it's a huge problem, but every once in a while you're going to run into somebody like that.
Well, I can tell you, coming from the rescue community, it actually is a little bit of a problem because there are some people that because it's hard to tell because not everybody is even a vet, because just because somebody's not a vet doesn't mean they can't offer a certain modality.
Sure.
But then you have to question is how were those people trained as well,
Right,
and
right.
some of them were trained with people and they try to push the services over onto your pet. Are they really qualified to do
Oh,
that?
I see what you're saying. Yeah.
So there's a lot.
I've had people tell me that they've taken their animal to their chiropractor, and I mean, I'm not allowed to work on my clients because I'm not a human doctor, and it goes both ways. You shouldn't
Right.
let a human doctor work on your animal. They don't know the anatomy or the physiology, and so there's, they mean well. Certainly, you would hope that they mean well, but I wouldn't work on a person. So.
Right. Yeah, and I think one good thing for people to do too is to do some research for themselves, is to find out, if somebody's suggesting a modality, look it up, find out, what it is, and then when you talk to the vet or the practitioner, find out what their training is, but also ask them how many times have they done this, like how long have they been practicing it. You can ask for referrals from patients, just to make sure that you're covered. Because also people want to make sure that you're getting the best care, because somebody could be qualified. Maybe you're going to somebody who's cheaper, but they really don't have any experience, and that's up to you how you want to spend your money for your pet. But that might help people as well as just finding out that information.
Yep.
So I want to talk about some more of the different therapies that you do. One of the things you guys just started offering was the cold laser therapy. Can you explain what that is and what that's good for?
Well, cold laser is actually stimulating the body to bring in components to help heal the inflammatory process. It works very well for arthritis. After surgery, we use it on a lot of our wounds. My colleague, Dr. Greer, uses it a lot because she's a surgeon, and we'll use it on our arthritic patients, our back dogs, that kind of thing. So I've actually, we have a couple of staff's dogs that are very old and very, very crippled, and it's unbelievable how much relief it gives these patients, mostly for the inflammatory process that goes on. I would think it would hurt, but it doesn't at all. You don't even know that it's happening, and they really seem to respond well. They relax, and a ton of them do well with it. So we're really excited. We're still learning about it, but it's really exciting.
Okay,
something new.
Yeah, because that's something when somebody hears the term laser, you're thinking a laser pointer, or you're thinking lasers in surgery. So you're thinking, how does it work? But somehow it does.
Yeah.
So now
it basically stimulates the body again to heal itself. It's all about making the body heal itself, and that's what herbals are. That's what acupuncture is. That's what all of these are, is helping the body heal itself. And I think that's what's most important when you're trying to help a person or an animal, is just helping their body do just that.
Okay.
Yeah.
Now, one of the things that you've been doing for a while, and you were, I think, one of the first people in Michigan qualified to do this, is the stem cell therapy.
Yeah.
So can you talk about stem cell therapy and what that is and who that's good for?
Well, stem cell therapy opened up in 2007 for veterinarians with the hope that it would go into the human side of it and be able to do that in the United States, where like you can do in other countries. And it's a certification that you get online, and it's a little bit involved, but it was wonderful, and I think every vet should get themselves a stem cell certification. And what it is like if you cut your hand, your body's going to send stem cells into that, and you're gonna have new skin, and everything's going to heal. And stem cells actually come and do that. And most stem cells actually are located in your fat. So what we do is we remove fat from the animal. We send it to the lab. There are some newer things that you can actually do inside of your office. But we send that to lab, and they process all the stem cells out of it. And what we do is we take those stem cells, and there's millions of them. and we inject them into a joint that's arthritic, and those stem cells will actually help form that arthritic joint, or at least help it to heal. It's phenomenal. It is absolutely phenomenal. And it's not magic. It's, again, just the body's process of healing with us giving it help. And instead of, a small amount of stem cells, we're doing millions of stem cells.
Right. So you're basically like redirecting the stem cells where you want them to
Where
go.
we want them to go. Yep, absolutely. It's not magic. It's what the body already does, but...
Great. And I think, and that's something that people need to remember about integrative medicine too, is that it isn't magic.
It's not magic.
And that's what people think, is there's a science behind it. There's a lot of education and training behind it.
Yeah.
And a lot of people just, like I said, they hear that word or they hear the term holistic and they just automatically think it's, it's just, somebody just invented it out of thin air, and that's not the case.
Right.
Can you talk a little bit about what was your training like to get to become a traditional Chinese veterinary medicine
Well,
doctor?
I was just going to say, when you're talking about that, I loved veterinary school. It was just one of the best experiences I've had in my whole life. But I want to tell you that the time I spent learning Eastern medicine was so hard. It was harder than anything I did in veterinary medicine. But I swear, every single day a light bulb went off. I'm like, I've seen that 1,000 times and not known that's what that was. So it's layers and layers and layers and layers of information on top of information. And the philosophy about it is beautiful, but it's so complicated. And like there's like 18 different types of arthritis,
Okay.
and we might have 3 in Western medicine, but the detail of it is just unbelievable. I feel like I've not even touched the surface of what's out there to know. So.
Okay, great. And that's, and I think part of it too is I know when I was talking with Dr. Greer about it, when she was going through her scrolling for it, it's a different chain of thought.
It is.
And so until you grasp that difference, it's very difficult to get into that mindset. And then once she understood where because it's a completely different philosophy, and then once she understood that philosophy and then how that partnered with the Western philosophy and not having to be exclusive, then that light bulb kind of went off. And
Western medicine is, you have a problem, you have symptoms, you have possible causes of it, you have tests that you do to figure that out, you have treatment plans. Your rule-out list is, well, what could this possibly be? In Eastern medicine, anytime you ask a TA or a professor a question, they're going to say one word. They're going to say, it depends. It always depends. So it's not this cookie cutter thing. Not that Western medicine is that all the time, but it's so different. You have to look at everything with the animal, which is important anyways. And we try to do that in Western medicine, but the Eastern docs have that down pretty good. Right. And it really becomes really complicated. Sometimes you can get lost in it, but once it clicks, it's just a beautiful way of looking at disease and helping to cure that. Great.
Well, thank you so much. We are just about out of time, so thanks for talking to us about integrative veterinary medicine. We appreciate you being on the show. I just wanted to remind everybody that we all look forward to a day when all pets are treated like family and everyone has a home. Until that time, we invite you to be part of the solution. And remember, please spay and neuter your pets. See you next time.